Yeah. So from cornea eye banking, now we move on to the tele-ophthalmology, reaching the unreached villages. Since Dr. Sanjay has to go to other session, we request him to talk to us about tele-ophthalmology. Dr. Sanjay Daulat Thakur. Over to you, sir.
Thank you, sir. Good afternoon, everyone. My topic is tele-ophthalmology, reaching the unreached villages. About 70% of the population of India lives in rural areas, while 70% of the doctors live in urban areas. This is a classical divide, and tele-ophthalmology plays an important role in bridging this divide and reaching the remote areas. So West Bengal Tele-Ophthalmology project was started as a pilot study in two districts of Bankura and Midnapur. 10 centers were selected in each district of Bankura and Midnapur. So a total of 20 centers were included in the study, and there were two nodal centers, Bankura Medical College for Bankura district and Midnapur Medical College for Midnapur district, where all those patients who needed surgeries or investigations were referred to, and for teleconsultation also, which was a synchronous teleophthalmology, real-time interaction between the ophthalmologist and the patient. So initially, a capacity building was done at Regional Institute of Ophthalmology, Kolkata and Vivekanand Mission. Vision centers were established, equipments were supplied, optometrists were trained, not only for refraction but for also slit lamp examination with photography, and internet issues were sorted out for teleconsultation at the nodal centers. So these two districts cover a population of about 26 lakhs, and during this 5-year study, about 2,32,000 patients were consulted, and most of these patients, about 40%, required refraction only, and only 6% were referred to the medical colleges. The reasons for referring to medical colleges: mainly cataract, about 7,500, and for retinal diseases which needed investigation, about 1,000. Surprisingly, we also got 66 patients with vitamin A deficiency even now. So now comparing it with other centers, Shankar Nethralaya started this with a customized mobile van which had all the equipments, and ISRO connectivity was provided, and then they also had this teleconsultation facility available and fundus photography facility there. So in a literature published in a journal in 2003, the now figures were that they conducted 6,500 camps, and about 7 lakh patients benefited from this teleophthalmology project. Of these, 25% required refraction only, and about 8% patients were referred for teleconsultation. Arvind Teleophthalmology Network has both vision centers and mobile van. There are 91 vision centers, cover a population of about 85 lakhs, and about 6 lakh patients are examined in a year, and 90% can be fully treated on site. They also have a mobile van from which about 74 screening camps were conducted for diabetic retinopathy, and the prevalence was about 10.5%. So the advantages are: we can reach remote inaccessible areas, it saves time, money and the effort of the patient, it provides expert opinion from the ophthalmologist, and a study has revealed that about 26% of the patients were living with potentially sight-threatening diseases without any access to specialized medical care. And this can also be used for screening for diabetic retinopathy, and patients are satisfied. There are some limitations like high cost of initial investment, last mile connectivity of internet, poor quality images because of small pupil and media opacities. Sometimes the trained staff leave the job, There are policy barriers, medical legal issues also, and you need regular updating of software and hardware. To conclude, it's a cost-effective technology which provides high-quality care to people living in remote rural areas, and very important, 90% can be fully treated on site. Early and timely treatment prevents permanent visual complications and blindness. Due to less time and financial implications, there is improved compliance of follow-up.
Okay.
So initially it was a very neglected area, but after COVID, it suddenly became a star because all the subspecialties had to rely on teleophthalmology to provide services because all the physical services were blocked. So I would like to take this opportunity for acknowledging the contribution of all the staff who provided the technology, all the staff of RIO Kolkata and Vivekanand Mission Ashram who were involved in capacity building, all the optometrists of the vision centers, and all the staff of Midnapur Medical College and Bakura Medical College. Thank you.
Thank you, sir. It was a fantastic this thing that we have just seen the amount of work that has been done and the people who have got benefited is in lakhs. And 90% did not require tertiary consultation. That is what is a go home message. So it is the thing that we need to implement all over. Thank